seen every skincare on the market, and you've created your own medicine. So, what inspired you to go into skincare?
Yeah, so along when I came out to LA, I mentioned that I had spent years studying with all the top doctors before I started my own practice. Because again, I wanted to be the best. I wanted my patients. I knew patients were spending a lot of money and putting their face, their career, their livelihood, their health in my hands, and I take that as a great responsibility. So I wanted to give them the best possible result that they could get anywhere. And so along those lines of learning all my surgical techniques, I also spent time with dermatologists because as a surgeon, as a facial surgeon and a plastic surgeon, you learn skin 101, very basic skin stuff, but you don't learn all the real sophisticated techniques and sophisticated.
It's crazy actually that you don't learn everything about skin.
Well, you don't have time.
I guess you're just slicing through it.
You don't have time. I mean, as a facial surgeon, there's so much anatomy, nerves, muscle, skeletal structure that it takes your entire residency to master that. To add skin, you just don't have time to learn it all. You learn the basics, but you don't learn those very advanced things. So when I went to along my studies, was lucky enough to spend some time with some of the top dermatologists in town, and I immediately realized there's much more advanced ways to deal with these things, and a lot of knowledge, a lot to learn that I didn't know. And so immediately I was exposed to the bioregenerative, biomimetic strategies, and the buzz terms that are now becoming popular. But I learned these terms 25 years ago: stem cells, nanofat, exosomes, PRP, things like this. And so I became an early adopter of those types of things. And so for my first like almost 7, 8 years in practice, I was doing those types of things in surgery with my facelifts. And like I had told you, I developed this early facelift reputation because, all based on my results. And a large part of that was the techniques that I had put together to create my own version of the best in class. But also, I was paying attention to the skin in these ways. And so I think that was a component and a part of the reason my results really stood out as well, because I was focusing on the skin too, which is extremely important. And so for years I was doing these things, and then I realized, I had enough experience and knowledge of how to use these things, and I saw how the skin reacted to these types of treatments, that I was like, you know what? I don't need to have people asleep to do this. I know enough that I can do this in the office for people who aren't asleep. And that's when I started honing and perfecting and tweaking an in-office procedure that became known as the Instafacial. Now it's known as the Diamond Instafacial. It's my multimodality skin treatment that became very, very popular on its own merit. And I like to tell people, like, people come from all over the world for facelifts. A lot of people fly from 12 hours, 18 hours away for facelifts and these big complex facelifts. And people will also fly me all over the world to do these procedures for them. But oftentimes people will fly from all different corners of the globe and fly me places for the Instafacial, which is such a small little procedure with like almost no healing. And I find it funny, like it's became so popular that people come far and wide for that too, because it works. And it became a Hollywood insider's favorite, and it sort of developed this cult-like following that became known as the Diamond Instafacial, which is a multimodality treatment, always involving a bioregenerative component to it. And so after years and years of doing the Instafacial, similar to my original epiphany, my original realization that I know enough how to do this, that now I could put it in a bottle on a shelf so I can offer to people who can't come to see me. And that's what motivated us to create Dr. Diamond's Medicine.
And I guess as a rule of thumb, the better shape you're in before a surgical procedure, the better the recovery and the results. And in what ways do you think using the Lyma laser makes a difference to people before a facelift even happens?
Well, before surgery, so when I'm going to do surgery on somebody, I want them to be in their best health. People in their best health get the best results. So I want people to be optimized. I want their mental, their psychology to be maximized. I want their blood pressure and their health and their hydration and their weight to be maximized. I want their skin to be maximized too. So we always have them do instafacials. We always have them do diamond instafacials well beforehand and get on medicine well beforehand to keep their face, to keep their skin maximized. And we'll have them do the Minsta facial oftentimes, which we'll talk about, where we use the Lyma laser, and when we'll send them home with medicine, and they'll use the Lyma with it to maximize results. So anytime somebody is maximize, they're going to heal the best and get the best results. So oftentimes I'll see people who are already on these things. Like, it's amazing to me that people, like, they know about these things. Like, the word is out. So I'll see people like, yeah, I've been using it for 6 months, a year, and I'm ready for my face. And we're like, okay, great. You're perfect. But just as often I see people like, okay, we need to get you maximized to get your best results. So we'll have them get on these things for 3 months, 6 months. And then by the time surgery rolls around, they're in perfect prime position to, like, heal rapidly and just do amazing.
Like in medicine, right? You take an oath, do no harm.
Mm-hmm.
And so I think Dr. Diamond should speak to the safety profile of the Lyma, as well as the safety profile approach that we take to R&D and formulation in medicine, because he doesn't compromise safety, but wants to achieve maximum efficacy, which is a huge reason why we love the Lyma so much.
Yeah. So the most important thing that we do is to do no harm, right? That's the number one. That's the Hippocratic Oath. Before and above everything else, don't hurt somebody. That's more important than getting a good result. More important is don't hurt somebody, right? And again, like we talked about with the fillers and being done on every street corner, like, a lot of people get hurt from that. The complications can be devastating, even though it's so easy to do and, like, almost anybody is legally allowed to do it. Well, similar, there's a lot of things out there that hurt people. I see people come in with damage from microneedling. Who would think microneedling could be damaging? But if it's done too aggressive, it can really hurt somebody's skin if it's not done right. Well, similar to all these types of devices, people can hurt themselves with things that aren't completely safe. But we know Lyma is completely safe, and it falls in line with what's essential to us when we create Dr. Diamond's medicine. We know everything is safe and effective. There's nothing that's going to hurt anybody, and so Lyma falls in line with that for us too. That's a big part of it.
I think it's really interesting, actually. You were talking about doing no harm, and there are so many technologies out there, especially to people at home, that actually damage the skin in order to stimulate collagen production.
Yes.
And what we've found through our research is that produces the same collagen, the same ratio of collagen fibers as in scar tissue. So it's not the same blend of collagen fibers that's found in youthful skin. I think that's where the damage-free technologies come into play.
Yeah, and as a facial surgeon, right, I'm in people's faces all the time. I've been for 25 years. I'm always amongst the first to become privy to the problems that some of these popular devices can cause. And I can remember, and I don't want to sit there and disparage any particular technology, so I'm not going to use any names of devices, but there was one of the real popular skin tightening devices like 10 years ago. I remember going into people's necks, like when because I always start the facelift in the neck. And I remember going in there and going, man, this doesn't look right. The fat in here doesn't look healthy. The skin quality doesn't look healthy. And I started to notice it, consistent with people who've had this one, particular, real popular kind of medical technology thing that was done in a lot of med spas and offices and things like that. And I call my colleagues who are facelift experts and I'm like, are you seeing this? And they'd be like, yeah, I'm seeing it. And you start to realize, like, that's not good, but yet it's being marketed like crazy. Every single office in every corner is promoting it and advertising. And, and people are, so this kind of thing happens all the time with all these little catchy, gimmicky devices and techniques and things like that. So yeah, people can really hurt themselves and like you said, create these kind of problems with many different techniques out there and many different devices. And we know Lyma is completely safe. I would never, anything we do in the office is going to be completely safe, completely effective, highest level. Like, people come to me, they know that we're not offering any gimmicky things. We're not offering anything that's a flash in the pan. There's so much R&D that goes into the things that we do. Our Dr. Diamond's medicine, so much research and development to make sure everything is, perfectly developed for safety and efficacy. And similar to Lyma, we know all the research that's involved in that too. We know no one's going to hurt themselves. And that's a big part of it.
Brilliant. Well, thank you so much for speaking to us today. Honestly, we've had so many questions in from so many people who just want to ask you everything. Thank you so much for speaking to us today and kicking off our Science of Youth series.